welcome to our Happy Workplace interview series, where in recognition of Mental Health Awareness Month, we'll be interviewing industry professionals to provide you guys information and resources to help your workplace become happier. So today we have Janine Bobko from Aligned Modern Health. Janine is the Director of Corporate Partnerships and Employee Wellness Programming at Aligned Modern Health in Killdeer. It's a great business that looks to incorporate alternative medicine to improve physical as well as mental health. So, Janine, thank you for joining us and welcome to the chamber.
Thank you so much for having us. Thrilled to be here today.
All right, for our first question, Janine, what is alternative medicine?
Thanks, Ryan. That's a great question. So, alternative medicine offers a non-surgical, non-pharmacological approach to healthcare. A lot of us kind of jump to these methods of treatment when there are really a lot of other really great, beneficial, non-invasive options to support the body's ability to heal with a little bit of expert help. So at Aligned Modern Health, all our alternative medicine practices include functional medicine and clinical nutrition, which I like to see is a really great way to look internally to better understand why you're feeling what you're feeling externally. So gastrointestinal issues, autoimmune disorders, bloating, constipation, fatigue, migraines, food sensitivities, men's and women's health and hormone balancing, nutritional counseling, really great ways to kind of look internally for a lot of our physical external manifestations. We also offer acupuncture, which is one modality under the traditional Chinese medicine umbrella. Acupuncture is a great alternative medicine practice for physical pain, but also some intangibles like stress and anxiety, depression, sleeplessness, seasonal allergies, men's and women's health. We have a nationally recognized fertility support program. So acupuncture can not only benefit kind of the physical pain symptoms we carry with us, but a lot of the intangible things that are a little bit harder to pinpoint sometimes. And then we round out our alternative medicine practices with physical medicine, and that is supported by chiropractic care, injury prevention, rehabilitation, clinical massage therapy, and athletic performance support. So each of these alternative medicine practices are supported by evidence-based data, diagnostic testing, and all of that really allows us to customize treatment plans for our patients without the use of drugs or surgery.
Awesome. So there's a lot of different ways to kind of attack and look at how the body operates to figure out what's best for us personally, person to person.
Exactly.
Awesome.
If you and I both went in with knee pain, we may have two completely different treatment plans because we're two completely different people.
Awesome. For our second question, we have a kind of a two-part question here is, how can alternative medicine benefit mental health? And what are some of the core systems in our body that are directly affected by stress and mental health concerns?
Yeah, this is a great question. It's a loaded question, but I like it. So I want to say the idea of treating mental health concerns, including stress, anxiety, depression, trauma, PTSD, it's incredibly broad, and everything within there is really highly personalized. So I don't like to make sweeping generalizations. I don't like to make universal statements. There's no one-fits-all treatment plan for something like this. That said, you hit the nail on the head, Ryan. There are a lot of core systems in our bodies that are directly affected by mental health concerns, by chronic stress. And when we leave it untreated, the manifestations of that can really, replicate tenfold. So there are a lot of core systems in the body that we do treat with a number of patients, even though this is all highly personalized. Some examples that come to mind are the head, which might manifest in headaches, sleep disruption, lack of focus, lack of motivation, different feelings of irritability, anger, sadness, anxiety, those kinds of things. The heart can manifest in chest pain, prolonged tightness in the chest, which is a terrible feeling. And when left untreated, obviously we are at higher risk for cardiovascular disease. The digestive system. So if you are having some periods of chronic stress or mental health disruption or disorders, upset stomach, poor nutrition absorption because our digestive system isn't working as it's supposed to be because it's kind of putting all hands on deck towards what we're dealing with. Early onset of IBS or irritable bowel syndrome, weight fluctuation that's otherwise unexplained, a lot of disruption in the digestive system. Our pancreas can be directly affected by some of these concerns. We know that elevated secretions of insulin over time can lead to diabetes, Again, not something that's going to happen overnight, but can be a long-term effect. Our reproductive system can be directly affected by mental health concerns and stress. So decreased libido or no libido, risk for fertility concerns, these kinds of things can manifest out of these concerns. Our immune system, of course, vulnerability to illness, inflammation in the body, a lot of internal inflammation that sometimes otherwise unexplained can be symptoms of mental health concerns, of chronic stress. And then obviously our physical body, our muscles, our joints, physical pain, muscle tension, muscle tightness, decreased physical activity, whether it's because we can't, because we're in pain, or we just don't have the desire to do it. We know movement is medicine. We need to keep our body moving, a well-oiled machine. And when we are in periods of chronic stress or mental health concerns, either the lack of ability to move physically or the lack of desire to do so can really take a toll on us. And we know that all of these examples over time can lead to high blood pressure, middle body weight gain, higher cholesterol, high blood sugar levels, decreased function in our digestive system, our reproductive system, our immune function. And then that in turn can lead to more fatigue, more depression, more insomnia, more physical pain. So it's kind of a little bit of a vicious cycle. So everything we talk about here, I'm not trying to dismiss or diminish any severe symptoms that you may be experiencing because of mental health concerns or chronic stress. But at kind of the level that we can all talk about together, do you want to bring up our nervous system? So a lot of folks will recognize the phrase fight or flight, right? That's very common. That refers to our sympathetic nervous system. Our sympathetic nervous system is designed to engage when there's an imminent threat upon us. So if you think back in the day, you're in your cave, you're doing your thing, you leave your cave to go forage for some berries, you round the corner and you're met by a saber-toothed tiger, okay? Our sympathetic nervous system is designed to kick in, to take care and address and put all of our bodily functions towards that immediate threat. But when we have stress in modern times, it could be work stress, it could be family stress, adult responsibilities, a global pandemic. These kinds of things don't have that clear-cut conclusion, which then in turn, our bodies stay in that sympathetic nervous state, that flight or fight state for much too long. We're designed to go back and forth so our body can heal and all of those systems we talked about can do what they're supposed to do. So what we want to do is try to engage or activate our parasympathetic nervous system. That's kind of like almost like the opposite of what we've been talking about. So the parasympathetic nervous system versus fight or flight can be thought of as calm and connect or rest and digest. This nervous system is triggered when the imminent threat is no longer upon us and our bodies can relax and kind of return to normal system function. We need to be able to return to a relaxed state over time to be able to function properly. One way we can do that is to practice some of the exercises we're going to talk about. So these are great exercises and techniques that we can all do together, so we encourage you to join us. First, I would like to talk a little bit about how to breathe. It's a technique called diaphragmatic breathing, and we think it's silly, like how to breathe. We breathe all day, every day. But what we really want to do is fill our diaphragm, the top part of our core cylinder, with our breath, externally making the belly rise and fall. This is how we were designed to breathe. So if you think of a baby, its belly rises and falls as it's breathing, right? As we grow up and we are conditioned as adults to suck it in and keep everything high and tight, we become shallow breathers. We become chest breathers. Our shoulders rise and fall, could lead to physical pain as well as to not getting enough of a breath. So in general, we want to practice diaphragmatic breathing, but especially and specifically when we do some of these breathing exercises that we're going to learn today. So to practice this, I want you to place one hand on your belly, one hand on your chest. The idea here is that our bellies will expand and contract with our breath because we're filling our diaphragm with air, and our chest will not move. Our shoulders will not rise and fall when we breathe. So our hands here are just indicators to let us know if we're kind of doing it right. They're not actually doing any part of the breathing for us. So take a few deep breaths in and out, and you'll want to feel your belly expanding with your breath. So you can see this hand here is moving, this hand here is staying really still. So we just want to keep that in mind as we go into these breathing exercises. The first exercise I'd like to teach is called 3 deep breaths. This is specifically designed to engage the parasympathetic nervous system, and I love this one because it can be very discreet. So you can do this at a work conference table in a meeting, you can do this at your desk, you can do this at the dinner table. Nobody will really know that you're doing a breathing exercise to calm yourself down in that moment. So the beginner version is exactly what it sounds like. We're going to inhale through the nose for a count of 3, exhale through the mouth for a count of 3, and repeat it 3 times. So Ryan, if you'll do it with me, I'll count us in. We want to think about breathing through the belly. Together we're going to inhale, 2, 3, exhale, 2, 3. Inhale, 2, 3, exhale, 2, 3. Inhale, 2, 3, exhale, 2, 3. Return to breathing normally. You may feel a little bit calmer, you may feel like your shoulders have dropped. Repeat that several times. Inhale through the nose for a count of 3, exhale through the mouth for a count of 3, repeat 3 times. Do several sets of that to kind of calm the body and activate that parasympathetic nervous system. The next one we're going to talk about is a little bit more advanced. It's called the 4-7-8 breathing exercise. And the idea here is that we're going to inhale through the nose for a count of 4, hold for a count of 7, and exhale very slowly for a count of 8. Now this can be difficult at first. A lot of us are not used to holding our breath. A lot of us are not used to slowly exhaling for that long. So if this is a little bit hard for you, that's okay. You may want to decrease your counts, but keep the ratios. So you might try a 2-5-6 or a 3-6-7 to start, and then build up to that sweet spot of 4-7-8. But today we're going to try whole hog 4-7-8 together. So again, keep in mind you're breathing through your diaphragm, breathing through the belly. We're going to inhale through the nose, exhale through the mouth on my counts. When you're ready, together we will inhale, 2, 3, 4, hold, 2, 3, 4, 5, 6, 7, exhale, 2, 3, 4, 5, 6, 7, 8. Breathe normally. This can be a little bit difficult. If you're feeling a little bit of lightheadedness, that's okay, especially if it's the first time you're trying it. If you ever actually get dizzy or see spots, please stop practicing for a little bit, return to normal breathing, and let your body collect itself. These 2 breathing exercises are not only really great when we are starting to kind of feel that fight or flight mode kick in, anxiety rising up, panic rising up, they're also really great to practice in bed at night, not only because it's easier to see our belly rise and fall when we're laying down, but it also kind of prepares our body and mind for a restful sleep.
Awesome, and contact them if alternative medicine might be for you. If not, there are great breathing techniques. There's a lot of great information about how the different systems in the body work to help us combat that stress and how we can take us out of that zone to help live a stress-free life. Thank you so much to Janine Bobko for sitting with us and interviewing with us today. It was great, and we learned so much great information. And thank you to Align Modern Health for letting us take her away for a quick interview.
Thank you so much. Have a great day.
Thank you.